This is a radial nerve glide. So what we're going to do, we're going to use what we know about the path of the radial nerve to slide it up and down. So the radial nerve is most stretched when I make a fist, I curl it, I rotate it in, and I bring it back behind me and I tilt my head that way. I can feel this tension going all the way down back here. And if I move my head, some of that tension goes away, which tells me it's more of a nerve stretch than a muscle stretch. So typically if your radial nerve is irritated, we are not going to want to do this. It's not going to feel great. Instead, we're going to offload the nerve and move it up and down. And so rather than kind of moving in this position, we're actually just going to have the hand relaxed and slightly up here. I'm not going to try to force it because that's kind of awkward in this position, and sometimes the radial nerve can co-present with some wrist extensor pain. And so I'm just going to have the hands relaxed, kind of fingers out, wrist maybe a little bit up down here. And then I'm going to bring my arm up and kind of come into this, I call it the T-Rex position. So I'm coming down and out, up and in, down and out, up and in. And I'm just going to do that. I want to look for a position where I'm not feeling stretch or symptoms. So if you feel symptoms through this area down here, I'm gonna have you tilt your ear to your shoulder, which can reduce tension. If you still feel symptoms, I'm gonna have you kind of more come out here in this range and kind of work down, because there's gonna be less tension on the nerve up here, okay? But still the same motions. That's kind of hand outstretched like this to curling in. And then you'll kind of work down until you feel that kind of edge of your symptom threshold, and then stay there. I typically like to do these for about 60 to 90 seconds, along with maybe some gentle self-massage along the path of that nerve, which is kind of roughly through here, several times throughout the day. And then I want to look to avoid positions like this, which can be reaching behind you, stuff like that. Reaching behind you in a car can be a big one, especially for the right arm if you're the driver. I want to avoid positions of nerve tension, so I definitely want to avoid some of these stretches. So until we start with nerve gliders, we see where that takes us, along with potentially some other treatment of the shoulder. But give that radial nerve glide a shot and let me know how it goes.